Welcome to Hilary Topper On Air, the podcast you can't afford to miss.
Did you know that 3.5 million Americans are using medical marijuana? But how do you know, or how does your medical provider know, what strain to use and what's most effective? I'm Hilary Topper, and this is Hilary Topper On Air. Today, I'm speaking with Stephanie Karasick, who is the co-founder and chief creative officer of Strainprint Technologies, the leading demand-side cannabis data and analytics company. Welcome to the show, Stephanie.
Hi, thanks for having me.
So can you tell me a little bit about yourself, your journey, and about Strainprint?
Sure. Yeah, for sure. Okay, so I am a 47-year-old mother of two who has struggled with anxiety and depression for most of my life, probably stemming from a childhood tragedy that occurred. And I was diagnosed with PTSD in 2014. And at the time, I had been on a series of different psychotropic medications throughout my 20s and 30s, and it was suggested that I look at medical marijuana, and I thought that was an odd suggestion, but I was certainly willing to give it a try. And lo and behold, it worked. So so basically what happened was I started experimenting with different strains and different varieties, and I started to find that different strains were affecting me differently, quite differently. Like sometimes I would feel sluggish, sometimes I would feel energized, sometimes I would feel relaxed. And I was like, well, there's got to be a little bit more science to this, I felt, but there really wasn't. So I just started documenting all of my experiences. And ultimately, that is what led me to think that there must be a better way. And that was what sort of initiated the thought of starting an app, essentially, like Fitbit is for your tracking your walking and your exercise, similarly to cannabis. So we've created an app that essentially tracks your experiences in real time with cannabis and how it's affecting and how it's helping you, the various different strains and dosages.
That's so cool, because it seems to me like it's all trial and error at this point. There's no real data.
Absolutely.
Yeah. So tell me.
Well,
yeah, go ahead.
No, I was going to say it is trial and error, and that is sort of one of the, I think, biggest stumbling blocks for marijuana. I call it cannabis, but either way, one of the biggest stumbling blocks is when physicians will say, well, I'm not really comfortable prescribing it because we don't know the proper treatment protocols or the dosages. And I certainly understand that. I certainly get that. But what makes me think about is that for all the psychotropic medications that I have been on, there have been about 6 or 7 total, none of them have been dosed correctly.
Right.
So none of them have worked. So I feel unfortunately, there's still I guess a double standard, or it just points to the lack of education at this point that's still required.
So you guys at Strainprint, you developed this app that's on an iPhone or an Android. Could you tell us like exactly what this app does and how people?
100%. Yeah, sorry. Yeah, so essentially what it is, it's a free app for patients. We want patients to be able to learn how to medicate more effectively, to learn what's working for them. So the app itself is free to use, very, very simple to use. We designed it so that anybody can use it for a variety of different. We have people on there that are, in their 70s and 80s, and they understand that it's just a very user-friendly process. And what it does is it takes your whatever symptom you're suffering with. So let's just say randomly a headache. You're suffering with headaches. It's going to ask you which medical marijuana product you are going to be using, what dose you're going to be trying it at, what is your headache before you start medicating, and then it prompts you in the accurate amount of time based on your method of ingestion. So if you're inhaling it, it's a shorter onset. So you'll be asked, how is your headache now after 20 minutes? If you're using oils, then it asks you after 90 minutes. Basically, that's just when the body is sort of metabolizing it most effectively, hopefully. So, and that's really it. You're just putting in your numbers, your pain scale rating. at which point all this data is anonymized. So we now are able to collect all this real-time evidence from patients. We have 1.3 million sessions that have been tracked by patients across a variety of different symptoms and disease states. And that is basically what we use to learn from. We're able to now create research papers from this. We are able to sell the subscriptions, to sell the data in a subscription form to licensed producers of cannabis, to researchers, to anybody who really wants to see how, in fact, medical marijuana is working for different issues.
So interesting. So talk to me a little bit about the privacy. A lot of people, there's this stigma still of, oh, you're on medical marijuana. So what do you do about the privacy? You said it's anonymous.
Absolutely. Okay, so we have taken every absolute painstaking. We have done everything required. There's HIPAA, FIPADA. There's all these jurisdictions that allow us to ensure that we're doing this in the most privacy compliant manner, and then all the data is stored and on different servers. And essentially, it's a complex thing. I'm not a tech person, but we have designed it in such a way that your personal information, first and foremost, belongs to you. But secondly, any information that goes into the data pool is just, all we know is your gender and your age and your medical condition and what you're using to treat it with.
Another question to that vein is, so different states have different varieties, and it seems like they all produce their own strains or their types of medical marijuana. How do you get a real reading across the board?
That's an excellent question. First thing I'm going to answer is that full disclosure, I'm in Canada, and so we're very lucky here in that we have had a medical program in place for many more years, and we also have now a federally legal program. So it is recreationally legal as well as medically legal, which what that does, it allows a lot more consistency across the board. And we also have all of the products are lab verified. So largely, about 80% of the data to this point is from Canadian product. Now, that being said, and to answer your question, you're 100% right. The different states do have different methods and protocols and governing laws about how the cannabis is produced and who's able to produce it and what strains and all those things. So the best thing that I would say is, depending on which state you're in, if you do have access to cannabis and you'd like to try it, that you would start by going to a reputable clinic or physician in that area, and they will have to just guide you with, the best that they can do. And then we say, track it and learn. Because if you just simply want to try something and you don't really pay attention to how you're feeling throughout the process, and you go back to see your doctor in, let's say, 3 months, and they ask you, how did it work for you? And I think it's okay, but I'm not sure.
Right.
You can't remember how well it actually helps you unless it's really in the moment. How bad is your headache? Oh, it's 8 on 10. How bad is it now after an hour? It's about a 5. Okay, now we know that you're actually getting a little bit of improvement. So that's the sort of the goal of teaching people to track and sort of showing them the benefits of being able to do that. We do know, we have seen now how well it works. After being in the market, we've been out for about 2 years now. So now, a lot of our app users are telling us how much this has benefited them and helped them.
It's awesome. It's really an awesome program. So you've collected data from 1.3 million patients.
No. That's 1.3. We have tens of thousands of patients. We try not to reveal the actual number of patients for privacy reasons, but we can say that we've had 1.3 million at this point, to the time I'm speaking to you right now. That goes up very quickly. These are patient sessions. So these are a patient putting in what they're suffering with and what they're using and how well it may or may not have helped them. So that's a patient that we call that a tracked session.
Got it. So at this point, what can you tell us about the medical cannabis industry and what are some of the key takeaways?
Well, that's obviously we could be here all day if I would answer that question in entirety. But what I could tell you is that, it is still a very emerging field, even though cannabis has been used medically for thousands of years. We are only now really sort of using it in modern medicine. And what's happening now is that patients are leading the charge, right? So, compared to years ago when doctors would prescribe opiates, and by the way, I'm not against doctors' philosophies and thoughts about cannabis. It's just that, and this is to further underscore, that it's still quite new. Right. And there is a lot of work required in the field to produce consistent medication that is reliable, that is supply is available, so that patients can use it the same as any other medication. So that is certainly, something that's happening slowly but surely. And as more and more states come on, if you're looking at the U.S., as more and more states come on and start to standardize a program, that will certainly further the cause. And the hope is that at some point in the near future, the U.S. will also be able to have a federally legal program so that people can travel and do all of the things that you would want to do with any other medication.
Exactly. All right, before we move on, I just have to take this moment to thank our sponsors. Please support our sponsors and tell them that you heard about them on Hilary Topper On Air. Special thanks to the Russo Law Group, MedPro, Strainprint, and Fortune Fine Jewelry. Now back to you, Stephanie. So there's still this stigma when using medical cannabis. Is there anything you think we could do about that? I think conversations like the one we're having, podcasts like yours, anything that sort of allows people to talk about their experiences in hopefully in a positive way, which is what we do here. We hear so many people that are living better lives thanks to using medical marijuana, that we just want to be able to have those conversations openly with our children, that this is medication. I have two kids. They're now 11 and 13. Mm-hmm. And I started using this 5 years ago, and I've always been very open with them. I choose to vaporize it. I mean, everybody has a different method that works best for them, but my kids know this is mom's medicine. This is not something that I'm just doing recreationally or, just to get high. They yes. know that. So again, the conversations, the normalization of the conversations around marijuana is really what's going to help erase or at least sort of combat that stigma that you speak of. So let's talk a little bit about mindfully medicated. What does that term actually mean?
Well, it's something that, we came up with that a couple of years ago when we started the app, really because the whole idea is if you're going to be tracking your experiences with cannabis, you really do have to be mindful about it if you're really going to be honest with yourself about how it's working. Mm-hmm. So the idea is really to just check in. How are you feeling? Like, how are you feeling an hour into using it, 2 hours into using it? If you don't use it, are there differences? Just generally being mindful about the experience of evaluating how well it's working. So we just try and let people know that, and we know that it's not a normal sort of behavior to just sort of mark down. I'm a real data nerd, so for me it comes easily. I can write things down in detail, and that's eventually what we use to design the app. But for most people, if you just take literally like 1 minute to check in with yourself, how are you feeling? You will find you'll have much better results overall because you'll feel more in control of the entire process. You'll feel like this is now like you have a little bit more say in it. And that's what we hear time and time again. So we just kind of keep that narrative going, because we do believe that having people be mindful about how they're using cannabis and how it's working is the most useful thing that they can do for themselves, especially in this era of not enough documented information.
Absolutely.
We are relying on patients essentially to inform medicine. This is really what's unique about this particular time in history, or I should say right now, is it's a really great intersection of technology and science and medicine. So we can use these tools to help us learn and hopefully get better. I mean, if you look at any medication that has to get approval to go into the market, I mean, we're talking about sometimes more than a decade and millions of dollars to get through the trials required.
Mm-hmm.
Cannabis is now being used by millions of people in North America, not even to mention around the world. So let's learn from these people. That's all I'm saying. Let's learn from these people. Let's learn what's working, how it's working, what they're doing, what they're having success with. And that's sort of the crux of what we're doing.
I love it. It's awesome, because what you're doing is you're putting it into the consumer's hands, their own health and their own well-being, so that they know and understand, and then educating the medical professionals about
that. Yeah, that's exactly what our goal is. We always state that we were designed by patients for patients.
It's awesome.
We have a lot of people in our company that are extremely passionate about helping other people feel better and live better lives. And that's really what motivates and drives me as the co-founder of this company.
It's awesome. So tell us how people could download the app and also get in touch with you for more information on some of this data that you guys have come up with.
For sure. Okay, so first and foremost, if you're a patient, easy. You just go to the App Store or the Google Play Store. It's free. You download it. Now, depending on which state you're in, we have pre-populated the app with thousands of different products. Like I said, we have the bulk of them are Canadian, because we have verified lab reports on a large portion of those products. Mm-hmm. If you're in a state that we do not have your products pre-populated in the app, you can just write to support at Strainprint, and we will investigate that. We'll try and our goal is to get your medicine into the app so you can track properly for it. We try and do that with lab verified product, obviously, because we want to make sure that we know what we're tracking against, not just some random name of a thing that you might have bought from a guy down the street that said Girl Scout cookies. That's sort of less relevant to us than what exactly is in that product, right? So that's the first thing for your patient. If you are in the industry, or you're a researcher, you're a physician, or anybody that really wants to learn from all this data, we have a very, very robust piece of software that we've created called Strainprint Analytics. And that is the software that is designed to filter and sort all this data, essentially. And if you are somebody that's interested in it, again, you can contact support at Strainprint. You can contact sales at Strainprint. There are many, many ways that you can get in touch with us. We're always happy to hear from anybody who's interested in what we're doing, because we do believe that it's just there's not enough people doing this work. So we all have to kind of band together and get the word out there.
And the website is
Strainprint.ca. That's right. So it's STRAINPRINT.ca.
CA for Canada.
Exactly. Everything you need should be found on there as well. So we just really, like I said a few minutes ago, we really just want to help people. And if there's someone listening to this right now that's sort of on the fence or unsure, we really have a lot of different things in place to kind of guide you and support you. We have a community as well that you can find access to on the website. We have a section on the app that can allow you to see what's working for other patients with your shared symptoms. So we keep learning from the patients, and we keep learning how to make the product even better.
Awesome. Well, thank you so much, Stephanie, for being on the show. Stephanie is
My
from
pleasure.
Strainprint. It's STRAINPRINT.ca, strainprint.ca. And I'd also like to thank our sponsors, the Russo Law Group, MetPro, Strainprint, Fortunoff Fine Jewelry, and last but not least, I want to thank you, our listeners, for tuning in. If you want more information on this show or any other show, visit our website at hilarytopperonair.com or find us on Spotify, iTunes, Google Play, SoundCloud, Mixcloud, you name it, we're out there. Have a great week, and we'll see you next time.